everybody. I'm Dr. Richa Trivedi from zenonco.io and Love Heals Cancer. Today's session is about creating awareness around cancer. Let me first introduce you to zenonco.io and Love Heals Cancer. We guide cancer patients in their journey with cancer. We aim to improve the quality of life of cancer patients through an integrative oncology approach that includes both medical and complementary treatments. We provide end-to-end care to cancer patients and help in their counseling sessions, medical cannabis, anti-cancer diet, Ayurveda, pain and palliative care. For today's session, we are joined by Dr. Amit Kumar Bagdia. Let me brief you about Dr. Bhagtiya first. So he has completed his MBBS from Maharashtra University of Health Sciences, Nashik. After that, he completed his MS in General Surgery from the prestigious AIMS, New Delhi, with 3 years of medical undergraduate teaching experience. He's among the leading oncosurgeon in Akola and the nearby districts around Maharashtra. He practices at Bhagtiya Hospital as a consultant oncosurgeon. So thank you so much, sir, for joining us today.
Thank you. Thank you for having me on your talk.
Is there anything you would want to say before we begin with the Q&A session?
Yeah, I'm really impressed by the all that you have integrated in your profile for Zen Oncology. Zen Onco. I did not know about the scope of your services, so I'm really impressed by your integrated approach to oncology, including pain, palliative medicine, and that's really a kind of integrated approach that needs to be taken care for our cancer patient, because it's not just surgery or medicine or radiation, but a patient, because whenever we, like in oncology, we always say we don't have just cancer patients, we have families who suffer from cancer. So it's really good to have that integrated approach always.
All right. Thank you so much for your kind words. Now, today's session is mostly going to be based around head and neck cancers. So shall we begin, sir?
Yeah, sure.
All right. So let's first begin with what the common head and neck cancers are.
Head and neck cancers are amongst the commonest malignancies in India. So it's very important that people around, especially in India, are aware about common head and neck malignancies. The most common malignancies that we see in India are those in the oral cavity or buccal cavity, as we say. Oral cavity lesions, then followed by other lesions in head neck, like cancer of the throat or larynx or voice box, as it is commonly called as. Then laryngopharyngeal cancers, nasal, paranasal sinuses, nasopharyngeal cancers, so salivary gland cancers, even cancers of the skin around skin and necks around head and neck. So those are all the malignancies that we commonly encounter in head and neck area. But by and far most common and usually what we understand from head neck malignancies are most commonly the cancers of oral cavity and throat.
Right. So, sir, what are some early signs and symptoms of head and neck cancers to watch out for?
So the signs of head and neck cancers are not. It's not head and neck cancer is not one disease. Like I always say, it's every area, every subsite. It's specific to the subsite that the cancer begins with. So if let's say the cancer is beginning in mouth or the oral cavity, the patient might have an obviously visible lesion or ulcer or a fungating growth, or patient will have some discoloration of inside the mucosa of mouth. So patient should be aware and should be watchful for any of those changes. If the lesion is a tumor that has developed in larynx or the voice box, or somewhere in laryngopharynx or base of tongue area, oropharyngeal area, so the cancer of that area will cause a spectrum of symptoms which will be slightly different than this. They'll have a change in voice. They might have a difficulty in swallowing. They might even the agony might even increase when they are unable to swallow their own saliva because of dysphagia. They might even have a breathing difficulty. Or patients who have nasopharyngeal or nasal or paranasal sinus cancers will have a different spectrum of presentation, like they'll have headache, diplopia, watering of eyes, epistaxis, that is nasal bleed. So yeah, it's a really conglomeration of different diseases which will have different presentation for specific to each subsite.
All right. And what are the major risk factors that can lead to head and neck cancer?
The single most common and most important risk factor that we need to be aware of is smoking or tobacco use in general, not just smoking, even chewed tobacco, any form of tobacco consumption. Tobacco consumption leads to cancer in more than one ways, and is a common etiologic factor in many cancers, not just head and neck cancers, like cancers of the bladder or cancer of the lung, or many other cancers where the prime etiologic agent is tobacco. So it's important to know that tobacco is not just one compound or one chemical. It's rather it's where a lot of chemicals are acting together uh, on the body of a tobacco consumer. So it's people usually attribute the all the side effects of smoking to nicotine, which is wrong, which is factually wrong, because nicotine is just the substance that keeps you coming back to tobacco. Like if there is a smoker who smokes again and again and again and is difficult finds it difficult to quit, that is because of nicotine. But uh, but it's not the harmful effects of tobacco per se are not due to nicotine. Like there is a common aphorism, common saying that says the patient keeps coming back for nicotine, but it's the tar that kills him. So the addictive component is nicotine, but the harmful component is tar, which has a lot of which is a mixture of a lot of carcinogens. So it's not just one thing that is killing the patient. So patient need to be aware of this, because it is important in quitting strategies, maybe, which we can discuss later. Yeah.
Right. So, like you spoke about tobacco habits, I mean, how do you motivate your patients to give up on tobacco once they get detected with cancer?
Well, once they are detected with cancer, it's quite easy to ask them to let go of tobacco, because they're quite motivated by the time they're detected with cancer. They're usually always saying कि डॉक्टर साहब मैंने बीड़ी छोड़ दी है. Like once they know कि cancer हुआ है, वो छोड़ देते हैं. So that's not a problem. But the problem is asking people to let go of tobacco before the cancer develops. And unfortunately and surprisingly, the most common age at which people pick up tobacco habit is in middle school or high school. So that's really the place we need to target and ask people to quit tobacco. Like quitting tobacco after detection of cancer is not going to help in the cancer prognosis, although it will help cancer treatment, because uh, a lot of reasons that we can discuss later. But really of prime importance is to detect smokers and tobacco abusers early on, like right in the ages when they are starting to pick up the habits, and ask them to kick the habit right at that stage, so that they do not develop into cancer.
Right. And what are the common screening tests that we have when it comes to head and neck cancers?
So, luckily, most of the cancers of head and neck, or especially of cancers of oral cavity and buccal cavity, would give us quite a warning period in which we can detect cancer in the earlier stages, because it is one of the accessible and visible parts of our body. So the patient can notice early symptoms like a lesion or an ulcer or a growth inside the oral cavity, which is persistent for some time and it's not healing to normal or the conventional lines of treatment, or has been growing in size, or it's not necessarily painful. That is an important point to note for the patients, that it's not necessary that your cancer lesions will be painful. So do not wait for pain to evolve in those lesions, but pick them early. Look for the early signs like a growth or bleeding or difficulty in swallowing or a change of voice, or maybe difficulty in breathing, uh, bleeding, like I always also said. So, or early changes like a patch or a discoloration of the mucosa. Commonly, what we see in our setting is a whitish plaque-like lesion, or leukoplakia, as it is called as, even some reddish plaques. So those are the early signs that need to be looked for. And screening is primarily either the patient, if they are aware and they are checking on themselves quite frequently, then they can detect those lesions early. Or whenever they perform the routine visits to a dentist or some other healthcare provider, those are the times when they can be screened for any lesions. And if any such lesions are found, then appropriate steps must be remedied as soon as they can be.
All right. And how vigorously do these head and neck cancers undergo metastasis?
So for that, we need to be delving slightly deeper into the biology of cancer.
Mhm.
Uh, I'll, at the cost of repeating myself again, I'll say that cancer is not one disease. So even if there is a, let's say, a patient who has a, squamous cell carcinoma of the oral cavity, how quickly that will metastasize depends on a lot of other factors. Like one amongst them is the grade of cancer or the differentiation. So every cancer is different. Like poorly differentiated cancers are more likely to metastasize faster than the slow growing or the well differentiated ones. Many patients will come that they have a certain lesion in their mouth since, let's say, 6 months, but it has not grown, which happens frequently. And then they'll say, but since last 7 days, last like 2 weeks or so, they find the lesion is evolving. Either it is growing in size or becoming painful, which was not for the past 6 months, or maybe it has changed its color or consistency or nature. So the speed is variable, and speed is not a definite indicator of malignancy, or evolution of lesion is not a definite indicator of malignancy, because it might be slow to start, and then maybe suddenly when it acquires sufficient mutations, the rate of changes or evolution can increase.
Right. Okay. And how important is it to know like the stage of your cancer?
Okay, so again, here I have an unpopular opinion.
Hmm.
What I think is that patients do not really need to know about the stage of their cancer. It's good for the physician, the oncologist, the oncosurgeon should be aware of it. But I do not think patients need to be aware of the stage, because again, stage is just a number. And stage, it's a common misconception that ek baar stage pata chal gayi to they know how long they're going to live, but it's not so. Stage is not just the only factor that is going to give them an idea about how long they survive. Once you tell them the stage, they frequently get into the competitive mode. They are like, okay, so my relative who lives in such and such place had such and such cancer and was detected in such and such stage. So now I know that because I'm in the same stage, I'm going to live for these many days, which is absolutely wrong idea. It's not the only factor that determines your survival or your outcomes, although it's an important factor. Also, let's say stage 3 of cancer of breast is not the same as stage 3 of cancer of head neck or stage 3 of cancer of pancreas. Every cancer has a different biology, so staging also needs to be assessed in that paradigm. Once the patient is given the stage, they assign a number to their cancer, and they have a certain notion that, okay, so the doctor has given me these many months to live. That is not correct. Physician or the surgeon or the oncologist definitely will work on the stage and give them stage appropriate treatment. But patients, by and large, should be aware of the disease, their extent of disease, the prognosis, and therapy alternatives available to them. But stage itself does not matter so much to a patient who is not uh, medically oriented. Rather, it's more of a, I would say, they get more confused, and they get more worried, upset, and misguided by stage. So unless they are really into medical literature where they can find in depth about their therapy options and stage and management, they should be given a broad overview of the disease and the therapy options and prognosis. But stage itself is not for the patients to go by, I think.
I think that was a very different way of looking at the staging of cancer. But
Yeah.
when it comes to treatment, what are the treatment options that one has for head and neck cancer?
Okay. So treatment, the by far the most curative option,
Hmm.
and is the radical surgery for head and neck. In most of the head and neck cancers, I'm speaking broadly. Of course,
Hmm.
again, it's dependent on the site and subsite, but broadly, in most of the resectable head and neck cancers, the best and the foremost option to give to the patient is a surgery, radical resection, along with nodal dissection, whatever basin is needed to clear, depending on the stage. So in like cancers of the oral cavity, predominantly, what the first and most favored treatment is a radical resection, reconstruction, and nodal dissection as warranted. In treatments in cancers, but this differs for cancers according to the subsite. Like if a patient has a nasopharyngeal, oropharyngeal, laryngopharyngeal cancer, surgical resection is not the always the best choice to look for. such patients might benefit better from radiotherapy in many cases. Some patients who have lymphoma, let's say lymphoma of the head and neck, might better with chemotherapy. Patients of laryngeal cancers, small cancers where radiotherapy, where surgery is not the only choice or the only best choice, can undergo organ preservation approaches like radiotherapy and other combined approaches where they can retain their function as well as a good curative treatment. So treatment also depends on the subsite, the extent of disease, and radical resection if possible. But in most cases, yeah, if I am to give a single answer, in most cases, in most resectable cases, surgery is the best choice to offer, followed by adjuvant chemotherapy or radiation if dictated by the histopathology and patient general condition.
Right. So, sir, like you spoke about surgeries, I mean, how are the everyday life functions affected after a patient undergoes surgery for a head and neck cancer? Like in case there's a glossectomy which is performed.
Yeah, okay. So that's a really important question when it comes to head and neck cancers, because head and neck cancers alter the very identity of patient, because most of the patients will identify themselves by the way they speak or the way they look or the way they talk. So these very functions are affected by head and neck cancers. What I mean is let's say a patient has a lesion in the buccal cavity and fungating on the facial skin. So when they undergo surgery, we remove a part of the facial characteristics, and it changes with reconstruction. So they frequently feel that the identity has changed. Sometimes, let's say like in tongue cancer surgeries, we remove a part of tongue, and they think that their voice has changed. So they think the identity has changed. So that head and neck cancers are debilitating that way. They change a person's identity, or at least a perceived identity, I should say. But with advances in reconstructive technique, advances in surgical technique, advances in radiotherapy delivery technique, we need not be worried as much as we would be earlier. Because with a lot of conservative surgical approaches and with a lot of good reconstructive and plastic surgery approaches, we are able to provide the patient a good reconstruction after surgery, a good rehabilitation. Even with the enrolling a lot of physiotherapists, occupational therapists, speech therapists, swallowing therapists. So we have a whole gamut of people working around with us to help the patients regain their original form and function. So even after mutilating or debilitating surgery in the head and neck area, today we frequently find patients who are retaining the identity, are able to speak as well as they could before surgery, are have a good, acceptable, functional, and aesthetic cosmetic outcome after surgery with good reconstruction and flap surgeries, good plastic surgeries. They can even have their voice, like even if in surgeries like laryngectomies, where we remove the voice box, they can have a prosthetic larynx built into them. So yeah, with all those reconstructive options and good surgical techniques and good RT radiotherapy delivery techniques, I think it has a bright, promising future for people who are undergoing treatment for head and neck cancers. They can expect a fairly good outcome with all of these.
Right. I think that was very well explained. Now, sir, since we know the impact which tobacco has when it comes to causing head and neck cancers, I mean, what steps can people follow to, give up their tobacco habits?
Okay, so giving up tobacco is not easy. I'll agree to that, what most of my patients will say, because I've heard every one of them, even people who really want to quit, find it hard. But it's not impossible. So if you follow definite steps, so there are a lot of commonly used approaches, but I frequently recommend them a 5-step plan. So first is that you come up with a plan. You tell me a date when you want to quit. So let's say in the next week, you just form a date when, okay, so this is the date when I stop tobacco. Once you are done with your plan, then you need to enroll more people on board with you. So the more people you tell about your commitment to leave tobacco, the more internally strong you are. Like, you must enroll your family, your friends, your colleagues, office people around you in the office, whom you meet. You just tell them that, okay, so I have decided to quit tobacco and I expect you to help me with it. So the more people you convey your determination, the more gritty you are about leaving your tobacco habits. Third step is keep yourself busy, because I have found that people who keep themselves not occupied tend to gravitate more towards the cigarettes. So they just it's just kind of a matter of habit. They tend to gravitate towards the cigarette butts more and more and more. So keep yourself busy. Would be better if you could occupy yourself with more activities like let's say walking, jogging, or exercise, because they also release endorphins and feel good factors that will partly compensate your need for cigarette, because most of the people give a reason that they feel stressed and hence they need a cigarette. So that's another part of an important activity that you need to add. Fourth important thing that I suggest is avoid the triggers that lead you to smoking. Like there are certain places that uh, subconsciously play with you, that and you start smoking because there are a lot of places you frequently visit to smoke. So if you go in those environments, you're likely to feel the craving again. If you frequently hang out with people who smoke, or your close people or group of people who smoke, so then you are more likely to get back to the cigarettes. If you see them smoking, it's difficult to resist. So I would say do not expend your willpower. Don't challenge your willpower a lot, because cigarette smoking, quitting itself is a hard on you task. So if you expend more and more willpower, it will be difficult. So rather keep to groups which are helpful with you to quit smoking, who won't smoke around you. Keep away from places that you would need to smoke. uh, Richa, just a minute, I think I'm low on battery. Can we pause the recording for a minute?
Sure.
Definitely, yeah. So yeah, and the fifth important point, after once you have avoided all those triggers, then the fifth most important point is you need to reward yourself for what you have done. Every minute, every hour, every day that you keep yourself away from cigarettes deserves a reward for yourself. Once you do that, that also subconsciously trains your mind to keep doing more of what you have done. So that's a reward circuit in brain that gets activated, so that keeps you doing more of what you have done for feeling good. So every day that you've kept away from cigarette, maybe you can reward yourself with a movie or a walk or time off with friends or something like that, just to keep you motivated. So yeah, that's a 5 step that I frequently recommend to people. Then there are people who then there are two different schools of thought on quitting tobacco. Like a lot of them will say that, okay, so this is the day, this is the minute, this is the time when I'll absolutely stop smoking, since that moment forever. So that's generally called as the cold turkey approach to cessation. There are another group of people who will say, okay, so I do not think I can stop cigarette at that given time or place or moment. So what I'll do is I'll taper it off. So like maybe 5 cigarettes on the day one, and then 4 on day two, and 2 by next week, and 0 by the 3rd week. So both of them are a valid approach. But what I would suggest is that a lot of people do it without supervision and by the just like self-help approach. But research has shown that if you enroll yourself in a guided or a cessation program, you'll likely to have better results. So yeah, if you can enroll yourself into one of them, please do it.
Those were very encouraging steps, I'm sure. I mean, I hope people adapt these steps. And so,
Yeah.
before we conclude, my last question for you is what are the everyday life functions? I mean, what are the alterations that people can make in their lifestyle to,
Mhm.
prevent cancer in a way?
Okay, so I'll take this question in a general approach, like not limiting myself to just head and neck cancers.
Mm-hmm.
Uh, Most common, like these days, we see that cancers are increasing. It's almost we are amongst a epidemic of cancer. Rather, cancer itself is a raging pandemic that we are not seeing it through. Because in last year itself, the number of cancer cases has been deaths due to cancers have been more than in the first year of COVID pandemic. The deaths of cancer were definitely a huge lot more than deaths due to COVID itself. But this cancer pandemic is going like getting swept right under the carpet, because information or news or awareness about this does not get TRP. So the social media, the mainstream media, newspaper, print media, TV media is all about ignoring all of them. So it's most important that we keep ourselves updated about this through our own reading. CMEs or even people enroll in awareness programs, awareness activities. Most important is awareness about cancers and how to avoid and how to change your lifestyle. Frequent, most common lifestyle changes that will help you in keeping yourself healthy and fit are schedules like keeping a fixed time for exercise, exercising routinely, daily, uh, keeping yourself into a good, fit, healthy diet regimen, avoiding a lot of fried or a lot of overcooked or stale or unhealthy or junk food. Uh, so this is like a general measure to keep healthy is a general measure to avoid cancer. Keeping healthy, eating good food, exercising, keeping yourself involved in productive activity, avoiding sedentary lifestyle whenever possible. Even if you are into a sedentary job, you can take steps to keep yourself uh, uh, active, like maybe yoga, pranayam, walking, jogging, exercising, gymming, all of those. Healthy diet, most important. Uh, Avoiding lifestyle triggers like obesity, with of course with good habits like diet and exercises. Not indulging in smoking. Absolutely avoiding all forms of tobacco is the most important step that you can do, and that's the most important gift that you can give yourself. If you cannot absolutely get yourself out of tobacco, at least limit your tobacco consumption, limit your alcohol consumption. Yeah, so those are the most important lifestyle changes that you can make for yourself.
Right. So thank you so much, sir. This was a very informative session that we had today. And once again, I would like to thank you for
Thank you.
taking time out and joining us for today's session.
Thanks a lot. Thank you.